What's up, people? How's it going? Hope you're having a great week. My name's Corey Besmer, and I am the host of this podcast, the sole original podcast, a show by entrepreneurs for entrepreneurs. And hope you're having a great holiday season. Christmas is just around the corner. I love this time of year. I love the weather. I love the lights. I love the reason for the season. And I hope you enjoy it. But anyways, today's episode is with our guest, Sarah Almilli. And she is the founder and CEO of ELAK Health. And she and her husband and her team are doing some great stuff in the healthcare world. Very innovative. And I can't wait to see, where they go, where they take this thing. But anyways, before we jump on in, just wanted to remind you to leave a review. Thank you to all that have left a review or subscribed on YouTube. That's right. If you're watching this on YouTube, make sure to subscribe and you'll, get notified with each new upload. So, thank you for watching, listening. I really appreciate it. And hope you have a great Christmas and holiday season. So now to the episode. All right. Well, here we go. Thanks for coming in, Sarah. Why don't you tell the people a little, tell me who you are and kind of what you do.
All right. Well, my name is Sarah. You got that part down. I'm a pharmacist by profession. I'm a clinical pharmacist. Okay. So that's a special kind of pharmacy, if you will, where we do a lot more clinical work and not your CVS, Walgreens kind of pharmacists. We sit in clinics and we prescribe and order meds for patients, order labs and so forth. So we do a lot of the physicians do work, but we don't diagnose. So that's me from a professional standpoint. I'm also the CEO and the founder of ELAK Health. Awesome. And I'm a wife, and I'm a daughter, and I'm a sister.
Awesome. Wear a lot of hats.
Yes.
So how did you get into healthcare? And I guess, how long have you been in healthcare? How long have you been a pharmacist? And even like what drove you to start ELAK?
So been in healthcare generally for a very, very long time. I want to say since 2018. Okay. I think my very first healthcare experience was when I did research at the NIH, the National Institute of Health, when I was doing my undergrad. Pharmacy has been kind of engraved in me, plus I grew up to like it from a very, very early age. I knew I wanted to be a doctor. I just didn't know which kind of doctor I wanted to be. And then I wanted to be a doctor of pharmacy, and that's where the journey kind of started. So in terms of healthcare, how long I've been practicing pharmacy, it's been more than a decade now. And then I've had ELAK for a couple of years now.
Awesome.
Yeah.
And so what is ELAK? Like, what do you do? What kind of, inspired you to go out on your own and start your own thing?
Yeah. So ELAK is a service, a healthcare service that we provide to patients that are adults, so anyone above 18. And it is there to make sure that no one ends up in the ER or a hospital for a preventable reason. I'm sure you've known some people or have heard of 911 calls, right, or so forth, where people may have like extreme headaches or stomach aches, or they think like their blood pressure is very high or it is high, and they end up going to the ER, right? And poor thing, like everyone loses their time, they lose their income if they have to take the day off. You stay in the ER all night or all day and you're frustrated and then you get out overwhelmed. A lot of things don't have to happen had ELAK been involved in the beginning and just been able to be there for you to say like, this is not ER needed. We can help you doing X, Y, and Z.
Okay.
So the way we do that is by having you text us right away. Like, hey,
Gotcha.
I need a doctor, and we're that provider at your fingertips.
Whether it's like maybe an emergency or just
Correct.
anything really, or
yeah, if it's a true emergency, we'll tell you like you definitely need the ER
Okay.
or call 911. Actually, even more
Yeah.
important, right? Don't drive yourself. But if it's like your blood pressure is like 160, I don't know what to do, then this is not 911 worthy, right?
Yeah.
Let them do other things. We'll take care of you
Yes.
and we'll tell you exactly what to do because the whole point is that we follow you every step of the way. And even when you don't need us, we're there. So when you do need us, you find us, number one, and number two, we help you stay and save all these other things that you may not want to get through or go into.
Yeah, gotcha.
Yeah.
So, like, what's the process like? Say someone does text you, where do you go from there? Do you
Yeah.
give them a call? Do you just text them back? And can they just text you out of the blue, like if they've never contacted you before, or how does that work?
So it's different. You're right. Every patient, every person is so different. Usually the way it goes from like A to Z kind of thing is that first you contact us like ELAK and you say like, I have this and this, I have blood pressure, let's just pretend, I have diabetes, or my mom has dementia, or my dad has Alzheimer's and I'm struggling, right? So first there's that struggle component. Why are you struggling? And then we get you into being one of ELAK family or the ELAK membership or ELAK subscription.
Okay.
And once you enter that, there's so many things that we help you with. Like we see you for 1 hour every single month. You text us all the time. Even if like sometimes you text us for things like, I'm at Winco and I don't know which Robitussin to buy, or I'm at CVS and
Great, yeah.
I don't know, there's so many Aleve and ibuprofens and Advils, what do I get? Or like, I need to take 4 of Aleve, is that okay? And right, like, so you can text even for the simple things, let alone the big things. And then if it's time that you feel that, oh my gosh, like I'm definitely not feeling okay, it's time for me to go to the ER, and you text us, yes, you get a call right away.
Okay.
We triage like, hey, what's going on? Tell me everything. Because I've already been talking to you for months, right? And I say, no, Corey, like that's not ER worthy. Take this blood pressure medication, for example, that I know that you have. And let's wait half hour and see how you feel and so forth.
Awesome.
And that's it.
Yeah. So is it considered like a kind of like a consulting service, would you say? Or
Yeah, it's a mix of all things, honestly. And I created it that way for a reason. So there is a medical consultation aspect to it because, you know, we're providers, we do that. There's a clinical advocacy part to it. So the end of that story, let's say you call and I say, no, you definitely need to go to the ER. It's time. We go to the ER with you. So that's the advocacy part.
Great.
So if you're in the ER and we think, yes, you should be there, then we have you put us on the phone if we're far away, or we go with you if we're close by within certain hours, obviously. And then we talk to the ER doctor and we say like, hey, you know what? This has actually been happening for a couple of months. This is what we think they need. Can you help us do X, Y, and Z? And ask questions for you and with you. Same thing if you end up going to the physician, right, and you need us there, or a nephrologist or neurologist or GI. You take us wherever you go, we're there. That way we're that central location. So that's the other part. So there's clinical advocacy, there's medical consultation, and there's almost like the hub, the center of all your healthcare things and needs and specialties.
Wow. Yeah, that's great. I was going to ask if there was like a physical component after like the texting. So that's really cool and unique. Did you kind of see a need in the healthcare world for just more immediate help like that? Because I think it's really smart just via texting, you know, being able to text, you know, a doctor, you know, basically to help, like you said, with like which Robitussin to buy. Even something like that can be helpful because, you know, Google has all these answers, but it helps to have a professional just like at your fingertips.
Absolutely. I think, so there are two things, and we all know technology is booming right now, especially in healthcare, right? So at least from where I sit, from what I know, there's either the health tech component where you do have access to technology, like sign up for this app, and if you have a question, you will get a provider, and they'll tell you what the things are, and then off you go. So there's no continuity of care. That's the challenge with this piece. It's not the
Gotcha.
same person over and over and over and over,
Okay.
right? And then there is the people that don't have that access to technology. I mean, I could be ignorant, but I can't
Right.
think of one system, even if it's a clinic, that allows the patient to directly reach to their physician. It's hard. I have not heard of it. Maybe it's out there. I would love to
Right.
see it, but it doesn't exist from my research. So that's why it's the combination of both worlds. You get to text your provider, pharmacist, clinical pharmacist, and there's continuity of care. It's not just a random provider. It's
Right.
the person you've been dealing with
It's
for
the
months.
same person
Yes.
every time.
Yes.
Yeah.
So
which
yeah,
is important.
it's great. It's amazing
You know?
because you know what we get? Like we get feedback like, just to have you at like my text makes me feel less afraid. And
That's great.
I go to
Yeah.
sleep at night knowing I'm doing something right with this company if I'm taking away fear, right?
Yeah.
Let alone clinical saving lives.
Yep.
Yeah.
Absolutely. That's cool. So where did the idea come from? Did it just was there a light bulb one day where it just hit you, I need to start this, or, and when did you launch it? I don't know if you said before.
A couple of years ago, yes.
Okay. It's been a couple of years.
It's been 2 years. So the idea came from honestly a lot of expertise and like seeing a lot in the healthcare system. So my husband and I are the co-founders.
Gotcha.
We are both pharmacists, different fields of pharmacy. He is on the outpatient, compounding, long-term care, and clinical pharmacy. I am on the clinical ambulatory care outpatient side. And between the both of us, he's been practicing for a lot longer than I have.
Yeah.
It's been like, I think 17 plus years for him.
Oh, wow.
Between the both of us, we see gaps in the system. We see gaps where patients are, falling short for the care that they deserve, right? My dad included, my grandma included, my brother included, literally my
Gotcha.
whole entire family, right?
Okay.
My mom too. And I'm sure I can relate to every family almost in this country when I say this. So that's where the idea started budding from. Like, why are we not doing better? And then I have an operational side of my brain that's
Yeah.
very strong, but just given my expertise, I've been in like operational positions for so long. It's like, well, where are the gaps in the system? And can we create a process to close these gaps?
Right.
And that's how the idea started like modifying over and over. And then there has been catalysts, I'm not going to lie. My dad's, health, or even my mom's health, my brother's health. And these were all catalysts to like, I want my parents to be treated differently and better and more timely and with higher quality, especially if it's not affordable with the amount of money that they're paying. And that was the catalyst to create ELAK and started baby, and now we're here.
Awesome. Well, yeah, I feel like that's how the best companies kind of come about, when you yourself have experienced the gaps you're trying to fill, right?
Absolutely.
And obviously with you and your husband being pharmacists, that's,
Yeah.
you guys can, I'm sure, see every day why something like this is necessary, right?
Absolutely. We
Yeah.
see. I mean, you enter a pharmacy, right? And I know there's a lot of concerns about outpatient pharmacy, but you enter a pharmacy and the pharmacist says like, oh, we have to call your doctor. And then what happens? The patient is frustrated
Right.
because it's now after 5. The doctor office is closed. The pharmacist can't reach the doctor, and it's no fault of the pharmacists, right? There's something obviously dangerous for you to have this prescription the way it is. So now you have to wait another day when you've already been overwhelmed all day long. It's just a vicious cycle that the patients get into. And I think my mission is to make sure I break that cycle.
Yeah.
Yeah.
I love it. Awesome. So I guess we were just talking about how, technology obviously it's changing every day. Do you see it changing your business? It's texting right now. Do you see that expanding to like an app or anything like that in the future? Are you still trying to I don't know, figure out how to, close those gaps like we said?
Yeah.
Because, with the technology we have today, just the possibilities are endless for so many different industries. And I think healthcare right now, a lot's probably changing,
Yes.
So guess that was a big question, but
I get it. I totally get it. Technology is so important, and who knows what the future holds. I think for now, I'm very focused on the personal, compassionate aspects of healthcare. I think that's the main pillar of ELAK. This is why, so ELAK in my language, it means for you. And every time I say the name, I get reminded that this is for the patient. It's not for the technology. It's not for the applications. It's not for how far I can take it. It's really meant, first and foremost, to be for the person in front of you. And if the person in front of me needs a human touch, then that has to be the center of all things ELAK. And I think that's what I'm focused on right now the most. Apps are great. If there is an app that will connect the patient, just like a text message to their own pharmacist, I'm all for it. But until that happens, I'm still using text messages.
Yes. Awesome. Well, man, you can't argue with that. I mean, it has to be about the person, right? And if, the technology can help with that, then you'll find a way to do it, right?
Yes.
Awesome. So, so let's talk about kind of like the business side. Have you ever, started a business before this one, or has your husband, and how has that been for you guys, just getting things up and running and learning the business side of things?
It's been a roller coaster for sure. No, I have never started a business before. So it's definitely been a very steep learning curve for me almost every single day.
Yeah.
My husband does have a business background, so I'm so thankful for that and for him to have that background to keep us balanced.
Awesome.
I have the operational background and like certifications and so forth. So between his business and my operations background, we're like going like almost very speedy. I always get that feedback, which is it's a good feedback to have, like, and we're very fast, which is a good thing. But we balance each other out. We like kind of play catch ball, like this idea. Well, how about we make it this way, or what's feasible versus what's not? So believe me, when we started ELAK, I will never forget that. We started making a lot of mistakes, thankfully not with patients, just with the logistics of the company. Sure. And then now we learned and we sound like experts, but it's really been 2 years.
Still learning, constantly
100%.
Constantly adjusting, right?
I mean, I've seen business owners and entrepreneurs after 20 plus years of owning their own business that are still learning every day. So I feel like that will be my life for the rest of my life.
Absolutely. I can relate to that. There's many times I feel like I have no idea what I'm doing. But at the same time, like you said, if you're focused on, your client, like ELAK is... It means for you. Right. And as long as you focus on the for you part, as serving your client, doing everything you can, then you're going to be fine, really. Like everything else will follow, right?
Yeah, no, absolutely. I was just, so I had the humility of accepting the 40 Under 40 award in Sacramento last week with the Sacramento Business Journal. And one of the things I said, thank you. One of the things I said in my acceptance speech was like, thanks to my husband who's been taking all my mistakes and chaos and tears and joy and like happy thoughts and negative thoughts. And as I was reflecting on that afterwards, it's because of what you just asked. Like there will be times where I feel like I have failed, right? Today, like, oh my gosh, I've done something. Either I haven't done anything or I've done something wrong or what I thought was wrong. But then I end up getting, a text from one of my patients that says like, thank you so much. I don't know what I would have done without ELAK. And that just takes it all away. Because if it's patient-centered, it's patient-focused. And for as long as I've done that, screw all the other things. It's all good. It will fix itself.
Right, yeah.
Yeah, and that's what wakes me up every day.
Makes it worth it, right?
Absolutely, yeah.
That's great. Cool. So, we met at Placer Valley, right?
Yes.
You were in like the startup challenge, right?
Yes.
Do you kind of explain to the people what that experience was like, or even what it was? And do you do a lot of stuff like that?
Yes. So these are kind of, think of it as ways to advertise your company, also compete in terms of how to advertise your company.
Because you got up there were, I think, 6 other people
Yes.
with, what was it, a 1 to 2 minute pitch of their startup, right?
Yes.
I'm sure that must have been hard and nerve wracking,
Very
in front of,
challenging.
all those people and stuff.
Yeah.
So how was that experience for you? Because I thought you did a great job.
Thank you.
Obviously, we talked after and stuff. But yeah, what was that like? And do you find yourself, seeking out more of those
I
opportunities?
did a lot of that. Yes.
Yeah.
I still do. So first, lots of credit goes to the city of Roseville and the Venture Lab in Roseville and the Growth
Yeah.
Factory, because this was a partnership between both of them. And they created a cohort called the Roseville Rising cohort. And as an entrepreneur, I became a part of that cohort. I applied, I got accepted. So I'm thankful for that experience. It's a 12-week program, and it really accelerates your company's path to success. So part of it is you learn how to pitch, i.e. advertise about your company in 3 minutes or less. And the other part of it is how to now communicate that pitch outside, right? In a public format and like on stage and all that. So yes, so this event, the Placer Valley 2023, was all of us, which is why you saw a lot of us. So that was the Roseville cohort, entrepreneurs presenting our pitches in 3 minutes or less each. We did that also in the Growth Factory. There's a lot of opportunities. I did that at Grow Tech in Chico, Tipsy Pot. There's literally, we do this a lot as entrepreneurs to, 1, practice, 2, promote and network our companies. And then 3, know how to talk about your passion outward, because we love what we do so much and we know it so well. And it's most of the time hard to explain that to someone who doesn't know anything about it, right?
Communicating what you do.
And sometimes you ramble for so long, and sometimes you're so short you're not giving it justice, and it's just finding that fine line. So practicing definitely helps with this.
I'm sure opportunities like that help you hammer down. Figuring out your mission statements and stuff, and sometimes you're rambling, trying to figure out how do I say this to someone who has no idea what it is I do.
Exactly.
Because I found that's the case with like I do a lot of networking, and I have had a couple opportunities to speak to a group of people about what I do, and it's a whole lot different than talking about it on a daily basis, like me with other videographers. Cause I do video production, but then when you have to, I've told people, I make videos for businesses. They're like, what? They'll still ask me so you do wedding videos? I'm like, no, not at all.
I get that. Yes.
You make commercials, marketing videos, videos that you'd see on a website, so I feel like, has it helped you communicate clearly, more effectively, just on a daily basis?
Absolutely. And now if you tell me to pitch, it's almost like an instant thing, like brain switch and you pitch, right? But it's different. I remember the first couple times I did it, people had no idea what I was even talking about. They were like, so what is it? So what? So what are you? And then as it started morphing, I started getting the feedback like, oh my gosh, this is such a strong story. It's amazing.
Yeah.
How exactly do you do this again? I'm like, okay, so the how wasn't clear.
Sure.
And then you morph again and they ask you so I heard everything, the how and the what and the when, but who are you? I'm like, I forgot the credibility component in the pitch.
Yeah.
So that's how you morph.
Because that's important. When people hear you and your husband are been pharmacists for, however long, right? 10 years, 17 years, right?
Exactly, yes.
Yeah, people want to hear that,
Right. So you start and it has to be within the 3 minutes. So what do you take out to put something instead? The credibility, is it the affordability? Is it the scalability? Is it the how, the what, the when?
How long do you spend on each of those things, right? Because they're all important.
Exactly.
And even like you were talking about with your family,
yes,
going through, the struggles they've had with healthcare and stuff.
Absolutely.
Yeah.
So that Roseville cohort was definitely helpful. So a lot of credit to them. Honestly, I wouldn't be where I am today in terms of pitching ELAK without them. So I definitely recommend it for anyone out there. And I do a lot of that. You are correct.
Awesome. So tell me where you're looking to take ELAK in the next like 5 years. Do you have any big goals for the future? I mean, gosh, it's only been 2 years, right? So where are you looking to go? What are you looking to do with it?
So my vision in the next 5 years is to have a lot of patients get to know, or people get to know about ELAK, so we kind of take their burdens away. So I always say I want to have a pharmacist in every city in California.
Okay.
Because I want every person to get the care and the attention and the quality that they deserve, which means the 1 hour, the after hours. So we open 8 in the morning to 9 p.m. every single day. So it's like the healthcare after healthcare shuts down. I want that for the rest of ELAK's life duration. And then I want this to be almost like a benefit to every employer, right? Like, I think we ignore that sometimes. Like, our employees they're grinding every single day. And we sometimes get to forget, or other executives get to forget, like, they have their moms and their dads and their kids and their husbands, right? And there's a whole life of a personal situation going on here. And then they come to work and they put a smiley face on, right? And they grind. So I would love if ELAK can be like that assistance program or employee benefit for all these employers. Because think about, if your employees are happy and they love where they work and they have the support that they need, then they are a lot more productive than sick calls, suboptimal mental health, right? All the things that weigh them down. And the employer or the company is what ends up hurting. So these are the two major directions of where I want ELAK to be in 5 years.
Absolutely.
Yeah,
that's
thanks.
great. Yeah. Cool. Well, are you just trying to be like really local right now to Sacramento, would you say, and like trying to expand after that, or?
Yes, absolutely.
Would you like to be worldwide someday?
Maybe one day, yes. Shoot for the moon, right? Yes, we're currently local to the greater Sacramento area. So it's like the range is very, very far and huge. We do have some patients and some partnerships in Southern California and LA.
Okay.
So they happen by accident, but we're growing there too. We took the opportunity.
Okay. So how big is your team right now?
So currently we are a team of 7 people. So we're still a baby company, which is why I'm not necessarily expanding exponentially in other areas outside of Greater Sac, because I want to make sure that I'm learning here. And then we can go ahead and scale that across the state and then across the country. And then worldwide, like you said. But the state first, one baby step at a time.
Not quite 5 years away.
Yes.
Probably.
No,
probably
I mean,
a little more
4
than
more.
that.
How many? Last time I read, 4 million people in California alone have ER visits that are preventable.
Wow.
So, I mean, let's just start with
there
4
you go.
million
Let's start
people,
with-
right?
Yep. Let's start small.
We'll
with
start
4
small.
million.
Yes. Yeah.
Awesome. Well, cool. Is there anything else you wanted to share? We're coming up against 30 minutes, but gosh, it's been great. It's gone by fast.
Thank you.
Otherwise, where can people find you on the internet?
Yeah, you can find us anywhere. YouTube, right? LinkedIn, Facebook, really every social platform. Our handle is at ELAK Health. That's ELAK Health. LinkedIn is under my name, Sarah Almilli. Our website is elakhealth.com.
There it is.
Yes. And then call us, talk to us, send us a message. You spread the word. Family members and all people that need any provider, we're here for it. We'll take it from here.
Sweet.
Yes. Thank you.
Well, thanks for coming on the podcast, Sarah. And to everyone else, check out everything she's doing. And ELAK is, it means for you, so it's literally for you. So follow ELAK on all those platforms.
Thank you.
I'm personally excited to see where you're going to take things.
Thank you so much for having me here. I really appreciate it. Thanks.
Absolutely.